Is a psych evaluation really necessary for each patient? Do you experience much pushback from the patient about having to talk to a psychologist?
I think it is most definitely a requirement, and answering this patient as a nurse, or this question as a nurse and a patient, it's extremely important. There's a lot of psyche issues that are going on prior to surgery, that help contribute towards the obesity problem in the first place. But as these weight is dropping off, there's still things that people may be struggling with: body dysmorphia, eating disorders. A lot of marriages suffer and cause conflict as people change and personalities tend to change. Maybe this is new to people. People really need to know how to work through these things as they come at them, and they're not blindsided. They really need to have a complete and adequate understanding of what they're getting ready to do, and how that is a lifelong change that's going to be long-term impacting. This isn't a quick fix that you just go in and magically you have the surgery and it's done, and you get to move forward. There's a lot of continued efforts and work that go into maintaining that and being successful with that in the long run. And do you want to add anything on that with the psych eval?
I think you actually covered it very, very well. I do think it's very important, and it does help. Often, as far as the pushback goes, we don't usually get patients that push back. I think once they go through the process and they have the testing and the interviews done, what they often find too is they're not really excluded from surgery if they have issues of a mental health nature. What is typically done is there's an outline given of a way forward. So recommendations are given if specific counseling is needed. Sometimes it's just a recommendation as simple as tobacco cessation. This is something that impacts them in their emotional health, and to stop smoking would give them the control that they need to move forward.